Medi-Cal changes website page. Hello, I'm Kevin Knaus, an independent health insurance agent in California, and I work with individuals and families. We usually go through Covered California, and sometimes they are Medi-Cal eligible, and sometimes their children are. And as we know, there are a lot of changes coming down the line for Medi-Cal programs based on new federal regulations. And there's a lot of changes that are going to be going into effect over the next couple years. And Department of Healthcare Services has put out an excellent page for Medi-Cal changes. And of course, they're going to be keeping this site updated because some of the changes that have been announced, there aren't a lot of specifics, so they'll be adding specifics to it. And of course, some of the changes may go away depending on what the state of California does, and also at the federal level. But when you go to this web page, updates, Medi-Cal changes, the first top program category is older adults and people with disabilities. And older adults, that is 65 years old and older, generally with Medicare, or you have a disability and you're receiving full scope Medi-Cal. And what I want to emphasize here is that these program changes do not apply to people that have gained Medi-Cal through Covered California. That is called MAGI, or Modified Adjusted Gross Income Medi-Cal, and it is only based on your income, not your assets. So the asset limitation applies to people that are 65 and older that have Medicare, because Medi-Cal is picking up the costs of Medicare if you're eligible. And then there are people with disabilities that also have full scope Medi-Cal that are subject to the asset limit. What we do know is that through June 30th, 2027, you can have assets up to $130,000 for one person, adding another $65,000 for each individual in the household. And still be eligible for the extra help through Medi-Cal for Medicare cost sharing. But this page says that starting July 1, 2027, the asset limit will be $21,000 for one person and $31,000 for two people. That's a significant change. And I already have people now that, maybe they got $140,000 in assets and they've had to spend down to get their assets under $130,000, so they qualify for the extra help through Medi-Cal. Now, those assets are, the bank accounts, cash, and if you have more than one house or more than one vehicle. What is not included in the assets is the home you live in, one vehicle, household items, and some savings like retirement accounts. A lot of changes for people who are immigrants that are not naturalized citizens or born in the US of A. Enrollment freeze, that began January 2026, so some adults with a particular immigration status are no longer able to sign up for full scope Medi-Cal. Now, on this page, there is a link. You can see their immigration status categories chart. You can click on that, and it's an excellent web page that shows all the different categories of different immigration statuses and what programs they may or may not be eligible for, with the dates that some of these conditions will be taking effect. But what is also important to know is that if you already have full scope Medi-Cal, you can stay covered no matter your immigration status. You do need to renew that Medi-Cal on time within the rules. So when you get letters in the mail, you want to open them up and read them. And if your Medi-Cal ends, you have a 3-month grace period to re-enroll into full scope Medi-Cal. But if you miss that, your Medi-Cal may go to restricted scope, which means they're only going to cover emergency care, pregnancy-related care, and nursing home care. So it's very important to read those messages you get and keep your address updated. Additionally, beginning in January 2026, people who will retain full scope Medi-Cal, even though there's an enrollment freeze, are children between 0 to 18 years of age, pregnant people, and people under the age of 26 who were in foster care on their 18th birthday. Now, the next category within that is fee-for-service transition. And fee-for-service, FFS, that is when you go to a provider and you receive a service and you may pay for it, fee-for-service. However, in this particular situation, Medi-Cal would be covering that cost. But what is important is that some people, especially immigrants, will not be in a Medi-Cal managed healthcare plan, one of the HMO plans. They will be transitioned to fee-for-service beginning January 1, 2027. And that's all people who are undocumented, some people with green cards who are in the 5-year waiting period before they can get full scope Medi-Cal, and some people considered permanently residing in the U.S. under the color of law, but allowed to stay without formal immigration status. Now, what's really important is if you still have full scope Medi-Cal, but you're not in one of those HMO plans, you still need to renew on time, make sure you get all your documents into your county Medi-Cal office, and you will no longer be in a health plan. So it'll be kind of on your own, and you can choose any doctor or clinic that accepts fee-for-service Medi-Cal. That's super, super duper important. If you go to a doctor or like an urgent care and they can't bill for Medi-Cal, Medi-Cal can't cover the cost. So you need to find out who does accept Medi-Cal and can bill for it. Like they mention here, fee-for-service does not mean you pay, but Medi-Cal will stay your primary, you will pay for your care, but you have to see a Medi-Cal provider. Specialty in mental health, substance abuse treatment will continue through county behavioral health plans. Your medicines will be covered by Medi-Cal RX, and dental care is not changing for most members. The way dental care is delivered depends on the county. And this is where we need to remember that counties in California, they kind of manage their local population's enrollment eligibility into Medi-Cal, and then also with the dental plans that may be available in the county. So the counties have a lot of responsibility when it comes to Medi-Cal, and they're the primary point of contact. So that's why it's always important to keep your address updated depending on what county you live in, because they're the ones that are going to be working on the Medi-Cal. Beginning in July 2027, there's going to be changes to dental coverage and monthly premiums. The dental coverage will be stopping for some people that have full scope Medi-Cal. Again, that's related primarily to immigrants. You can still get emergency dental services for like serious tooth pain, infections, and tooth extractions, and it will not affect children under 18, pregnant individuals, and those under 26 years old that were in foster care. But everyone else, you won't be able to get one of those HMO dental plans if you don't have the correct immigration status. July 2027, again, immigration status changes. And if you are affected, you will continue receiving state-funded full-scope Medi-Cal through June 30th, 2027. And this is really impacting refugees and asylees, humanitarian parolees that are here in California, and survivors of domestic violence or human trafficking and have a pending status. They're all going to be eliminated from being able to participate in Medi-Cal. But again, check that immigration status page to see if you might be in one of those groups. This is also affecting many people in covered California, people with work visas who will no longer be able to receive the federal subsidy for their health insurance if they don't have the correct immigration status, if they're on a work visa. So it's going to be affecting a lot of people. Beginning in July 2027, right now there's going to be monthly premiums for some members who need to have full scope Medi-Cal, and again it's going to be kind of immigration related, so check the status. If you don't pay for your Medi-Cal coverage, and we do not know how high those monthly premiums will be, you will lose full scope Medi-Cal and you'll go into restricted scope. So they're only going to cover emergency care, pregnancy related, and nursing home care. It won't affect children or pregnant people, or if you're age 26 and were in foster care as your 18th birthday. The next category on this page are adults, age 19 to 64. So you don't have Medicare, but you do have Medi-Cal. This is the MAGI Medi-Cal, Modified Adjusted Gross Income Medi-Cal. So beginning in January 2027, work rules. Yeah. Some adults will need to work, volunteer, or go to school to participate in training to get and keep Medi-Cal. They're going to be sending out letters on this. I think they've got a lot of the rules down. I think it's going to be kind of chaotic. And this applies to adults 19 to 64 years old who are eligible for Medi-Cal because of the Affordable Care Act expansion. That's the modified adjusted gross income. And that also includes adults in the new rules for immigrants. It doesn't apply to children, older adults that are 65, people on Medicare that have Medicare Parts A and B, because that is the Medicare Savings Program. You're 65 and older, Medi-Cal Extra Help. And you need to check with the county office because they're the ones who are going to be sending out the letters and managing this whole work requirement thing. And so this is beginning in January 2027. And if you do have this full scope Medi-Cal, and it's the expanded Medi-Cal, modified adjusted gross income, you need to work at a job and get paid at least $580 per month, or be a seasonal worker and make that $580 a month over the last 6 months. Be in job training. Volunteer, do community service at least 80 hours per month, be in school at least half time, do a mix of those things. How are you going to supply all these documents to the county? I think they're still trying to figure all of that out, because that's going to be a nightmare and kind of a mess. But if you do not, meet the rules and conditions, you could lose Medi-Cal. And again, you're going to get a letter from your county office. So open it right away and respond quickly, as they say. And, watch for those letters and make sure your correct current address is on file with the county. Also happening next year in January 2027, less time to get help paying for old medical bills. So right now, someone could apply for Medi-Cal and the county will look back 90 days and pick up anything like an emergency room visit. But they're shortening the look back period of when they'll cover some of those bills. So for adults without children, Medi-Cal will only pay for 1 month of past due bills. So if 3 months ago you had an emergency room visit and then you finally got around to applying for Medi-Cal, next year they won't cover that emergency room visit because it's outside the time period. So if you do have services, as soon as you can, you need to get enrolled in Medi-Cal to have them cover that. Other people, the look back period will just be 2 months. So they're shortening what Medi-Cal will pay in arrears for some of those services you received. 6-month eligibility checks, and this gets back to the work requirement. That begins in March 2027. So twice a year, some Medi-Cal members will have their eligibility checked twice a year. And for adults who are eligible for Medi-Cal because of the Affordable Care Act expansions, including members subject to the changes for immigrants listed above. This will not apply to are members of certain Affordable Care Act new groups, pregnant women, Alaska Natives, and people age 26 that were in foster care. But if you miss the deadline for filing the information about that you've been working, you've been going to school, you've been volunteering, then you may lose full scope Medi-Cal and go into restricted scope Medi-Cal or lose it altogether. So you really need to communicate with the county, and I think the counties are probably still working on how they're going to be, collecting all of the documents from you and how it's all going to be sorted. October 2028 co-payments. This is a ways off, but eventually it looks like that beginning October 2028, some adults in Medi-Cal will have to pay a fee called a co-payment. That is a set fee for a particular service. And it will apply to, the MAGI Medi-Cal crowd, 19 to age 64, but not if you're pregnant or on Medicare, because and also probably disabled. But it looks like from this page here, if the copayment will apply if your income is $15,560 a year. That sounds like 100% of the federal poverty line. So if your income is zero or very little, you wouldn't have the copayment. But if you're in that little window of 100 to 138% of the federal poverty level, then you will have to make a copayment for certain healthcare services, durable medical equipment, labs, things of that nature. They don't list them. Of course, if your income is over 138% of the federal poverty level, then you'd be eligible for Covered California and the subsidies. And they note that you would have to pay no more than 5% of your household income to those co-payments. And there will be no co-payment if you receive services from a community health center, a rural health center, emergency care, regular checkups, care during pregnancy, pediatric care, and mental health and substance abuse disorder. But that's kind of down the way. And again, some of these new rules may change. That's why it's good to go back to this website and see if anything has changed, income requirements, maybe California might institute something differently, or the federal rules may change, because I do know that there's some pending litigation lawsuits revolving some of this stuff. So we'll have to wait and see. So check that webpage. If you have any questions or comments, you may leave those down below and I'll do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.